Hi, I'm here with my veterinarian, Dr. Colleen Currigan, and I will say that I know that cat-friendly practices are extremely beneficial to cats, as is preventive care, visiting your veterinarian at least once a year. But it really all begins at home when you take out the carrier, getting your cats acclimated to the carrier. Now, one little trick that can help is a product called Feline. It helps to lower anxiety.
And Steve, actually you were setting Roxy up for a successful visit even in the waiting area.
Here in the waiting room, our cat Roxy is elevated. All cats love to be elevated, feeling more comfortable that way. Besides, you don't want a dog, if there are dogs around, sniffing right into the carrier or your cat to be staring off with another cat. So here's what you do. Simply turn the carrier toward you. You can also cover the carrier with a towel. Many cats feel more comfortable that way. Now that we're in the exam room, Dr. Currigan, how do we make this visit cat-friendly?
Well, first of all, Steve, I want to commend you for bringing Roxy in for her checkup visit. Normally, when a cat first comes into the examination room, I like to give them some time to acclimate, and that certainly can vary from cat to cat. So I normally like to have the carrier either on the floor or perhaps on the examination room bench, while I talk to you a little bit about your family and what has happened in your world since we last saw one another, and also get some good history on Roxy. We all know that cats are very good at hiding pathology and pain, so a lot of times small behavior changes that might not be significant in the eyes of the owner are very significant to the health care of the cat.
But at what point in time do you remove the towel?
Steve, that's a very good question, and in many cases it depends on the anxiety level of the cat. If the cat is very anxious, I may leave the towel on until I'm ready for the examination. In the case of Roxy, who's a pretty mellow kitty and she's pretty used to veterinary visits, I may remove it right now. And when we remove the towel, that allows me to open the carrier door, and I can also quietly lift the top, and that allows Roxy the opportunity, if she so chooses, to get out of the carrier. And if she's out of the carrier and wandering around the examination room, I can observe her gait, I can observe her posturing, her demeanor, all of which is very important in helping me to evaluate her health status.
Is one secret to being cat-friendly letting the cat make the calls as a veterinarian?
That is one secret of being cat-friendly as well as being a cat owner. Cats definitely are a less is better species. The less we try to restrain them and the more time we give them to calm down, the more likely they are to perceive the visit as less stressful.
So as a cat owner, why does it matter that I choose a cat-friendly practice?
Steve, the cat-friendly practice program was established by the American Association of Feline Practitioners, and there is quite an extensive list of criteria that must be met by any practice choosing cat-friendly practice status in order to be designated with that title. Criteria involve not only medical care of the cat, but also appropriate cat-friendly handling, cat-friendly advocates in the hospital, cat-friendly caging, cat-friendly communication with owners. So there's a lot of criteria that really make the cat-friendly practice program a terrific program, and cat-friendly practices should excel in treating cats.
And that includes the fact that the cat is in charge?
Absolutely, as always.